That, ladies and gentlemen, was a surgical orthopedic nurse at its finest. How do you become a surgical orthopedic nurse, you might ask? Well, we begin the journey of becoming a certified surgical orthopedic nurse by becoming a registered nurse first. This entails earning a nursing degree and passing the National Council licensure examination for registered nurses. There are several levels of education a certified orthopedic nurse can get. They can earn a Bachelor's of Science in Nursing, a Master's of Science in Nursing, and even a Doctor of Philosophy in Nursing. The Orthopedic Nurses Certification Board offers 3 certifications. These certifications are offered to registered nurses with no graduate degree, nurse practitioners, as well as clinical nurse specialists. Orthopedics is not offered as a primary specialty by most nursing schools. It is considered a subspecialty concentration, which can be earned through graduate study for advanced practice nurses whose graduate level education specialty track is either gerontology, family, pediatric, adult primary care, or adult acute care nursing.
I am currently exploring my options as a nurse, and I stumbled upon nursing in the field of orthopedics. Anatomy was my all-time favorite class, and when learning about bones and muscles, I got to thinking, is there a specialty in nursing where you can focus in on bones? And that is when I started researching. I even went on the internet and found a local orthopedic nurse that I could talk to. Thank you for meeting with me today. I have several questions that I would love to ask you. In my intro to nursing class, many skills were talked about that a nurse encompasses in their day-to-day career. And what I would like to know is, what are the most important skills when specializing in orthopedic nursing?
That's a very good question. When caring for a patient who has undergone orthopedic procedures, it's multidisciplinary. As well, the responsibility is large. Orthopedic nurses have a wide variety of settings from which to choose. You may find an orthopedic nurse in the hospital, in a physician outpatient practice, in a nursing home, in industry, in academia, or even home health. Our areas of practice include emergency departments, operating rooms, adult orthopedic units, pediatric orthopedic units, adult medical surgical units, and many more. So as you can see, basic nursing skills are required, as well as honing in on the specifics for orthopedics.
Thank you so much for the information. This really helps me in my decision in becoming an orthopedic nurse.
The designations and procedures of an orthopedic nurse starts with something very simple, the education of a patient. An orthopedic nurse gives patients realistic expectations for the entire procedure and sometimes options other than surgery, such as a plan for weight loss if that route will be better for the patient. They help the patients understand what will happen during pre and post-op as well as during the actual operation and plans for discharge. Ortho nurses care for those with whole joint replacements and other major surgeries to those needing only a few sutures. One of the last designated procedures that is assigned to ortho nurses is the job of monitoring the patient's mobility. Nurses coordinate with physicians and PTs to form a schedule that will aid in recovering mobility and allow the patient to return home as soon as possible.
An orthopedic surgical nurse assists patients before and after their operations for fractures, broken bones, joint replacements, and genetic malformations. The nurse preps the operation room by setting up all tools and instruments the doctor will require to perform the operation, orthopedic sets, drills, plates, screws, retractors, and the like. If the doctor orders includes casts or splints, the nurse will set them. The nurse follows the patient post-operatively, monitoring vitals, checking bandages and casts, checks for bleeding sutures, and managing pain. Nurse will coordinate with physical therapists to have patient up and walking within the first day. The nurse educates the patient and the family on the use of durable medical equipment, how to dress wounds, how to safely get out of bed, how to safely sit and stand from the toilet, moving without injury, and pain management while at home.
Surgical orthopedic nursing has many risks and benefits. Some risks and benefits are physical, mental, social, emotional, and financial. Nurse.com lists the following as drawbacks: multiple demands of staffing and workload, difficult patient contacts, stress, physical strain, excessive paperwork, while it also lists the following as benefits: patient care and relationships, making a difference, teamwork, cases of dramatic improvement, variety of patients' ages and illnesses, with a whole variety of positions to be filled in surgical orthopedic nursing, such as staff nurse, clinical nurse specialist, nurse case manager, head nurse, supervisor, coordinator, director, and executive. The risks that a surgical orthopedic nurse may have physically is a potential injury on the job due to lifting a heavy, non-ambulatory patient. However, the benefit from being a surgical orthopedic nurse is the lowered stress of worrying about keeping or finding a job, as there is a job security in that it is more lucrative and more of a niche in nursing. Another social benefit would be that a surgical orthopedic nurse usually works 12-hour shifts and hence only has to work a 3-day week to work full-time, allowing more time with the family. In addition, the 12-hour shifts can leave time for one to pick up an extra shift here or there, putting a nurse in overtime or double time. So it may not be quite this, but it could be this, which is better than this.
Now that we have stepped into the shoes of an orthopedic nurse, it is time to reveal some facts about this enticing career. How much does your average general orthopedic nurse make? According to the U.S. Bureau of Labor Statistics, the median salary for your orthopedic nurse in a hospital setting is an estimate of $66,220. If that amount does not seem to meet your expectations, the BLS mentioned that orthopedic nurses who worked in transit and ground passenger transportation industries averaged a sum of $86,780. This puts orthopedic nursing as the 8th highest paying nursing specialty. An orthopedic nurse practitioner with an MSN can earn up to $94,000. This is 55% higher than average salaries for all job postings nationwide. The BLS had no statistics about how many orthopedics are currently employed, but job growth for orthopedic nurses has increased by 19% since 2012 and is expected to increase steadily throughout the upcoming years.